Balance training concepts. The purpose of the lesson is to provide the fitness professional with a fundamental level of knowledge regarding the use of balance training. This presentation will also allow the health and fitness professional to select and administer the appropriate balance training protocol for all clients. Following this presentation, the participant will be able to describe balance and its purpose, rationalize the importance of balance training, design a balance training program for clients in any level of training, and perform, describe, and instruct various balance training exercises. Whether on a basketball court, stability ball, or walking downstairs, maintaining balance is key to all functional movements. In functional activities, balance does not work in isolation. Therefore, it should not be thought of as an isolated component of function. Balance is a component of all movements, regardless of whether strength, speed, flexibility, or endurance dominates the movement. Balance is often thought of as a static process. However, functional balance is a dynamic process involving multiple neurological pathways. The ability to reduce force at the right joint at the right time and in the right plane of motion requires optimum levels of functional dynamic balance and neuromuscular efficiency. The balance mechanism. Balance training should constantly stress an individual's limits of stability, or balance threshold. An individual's limit of stability is the distance outside of the base of support that he or she can go without losing control of his or her center of gravity. This threshold must be constantly stressed in a multiplanar, proprioceptively enriched environment, utilizing functional movement patterns to improve dynamic balance and neuromuscular efficiency. Training functional movements in a proprioceptively enriched environment, or unstable yet controllable, with appropriate progressions, correct technique, and at varying speeds, facilitates maximal sensory input to the central nervous system, resulting in the selection of the proper movement pattern. Appropriate proprioceptive progressions would include performing balance exercises first on the floor, then a half foam roll, then an AirX pad, and finally, a Dynadisc. This is very important to understand to ensure an individual is not being placed in environments they cannot control. This will lead to compensation, neuromuscular inefficiency or improper movement patterns, and possibly injury. Balance training has been shown to be particularly beneficial to improve dynamic joint stabilization. Dynamic joint stabilization refers to the ability of the kinetic chain to stabilize a joint during movement. Improvements in dynamic joint stabilization, or balance, has been shown to assist in decreasing the risk of injury and improve performance. Research has demonstrated that joint dysfunction creates muscle inhibition. Joint injury results in joint swelling, which results in the interruption of sensory input from articular, ligamentous, and muscular mechanoreceptors to the central nervous system. This results in a clinically evident disturbance in proprioception. It has been demonstrated that sensory feedback to the central nervous system is altered following ankle sprains, ligamentous injuries to the knee, and low back pain. This is critical for the health and fitness professional to understand because 85% of the adult U.S. population experiences low back pain. An estimated 80,000 to 100,000 anterior cruciate ligament, or ACL injuries, and 2 million ankle sprains occur annually. Thus, muscle imbalances, joint dysfunctions, pain, and swelling can lead to altered balance. Therefore, the majority of the clients that health and fitness professionals work with may have decreased neuromuscular efficiency. It is imperative to understand balance and how to design a balance routine that caters to the needs of today's clients. A balance training program is a vital component of any integrated training program. It ensures optimum neuromuscular efficiency of the entire kinetic chain. The program must be safe, systematically progressive, and proprioceptively challenging. Health and fitness professionals must follow specific program guidelines and proper exercise selection criteria. To ensure the balance component is progressive and systematic, there are 3 levels of balance training within the OPT model: balance stabilization, balance strength, and balance power training. For each level of balance training, there are specific balance exercises and acute variables that would be appropriate to incorporate into each program. Balance training exercises. In balance stabilization training, The balance exercises involve little joint motion. They are designed to improve reflexive joint stabilization contractions to increase joint stability. This means that when the body is placed in unstable environments, it must react by contracting the right muscles at the right time to maintain balance. The first example of a balance stabilization exercise is a basic single leg balance. Lift one leg directly beside the balance leg. Keep the hip and knee on the balance leg slightly flexed. Contract the gluteals on the balance leg, as this will help control the balance leg. Make sure the foot of the balance leg does not flatten excessively, and make sure the knee stays in line with the toe. Do not allow the knee to buckle in. The hips should stay level, no hiking, and the spine should remain neutral, no flexing or extending. The second example is the single leg balance reach. The setup and mechanics are exactly the same as the single leg balance, but now we will challenge one's limit of stability by reaching their floating leg into multiple planes. First, reach in front or behind the body to challenge one's balance capabilities in the sagittal plane. Then reach out to the side to challenge one's balance in the frontal plane. Lastly, reach behind to challenge balance in the transverse plane. In all planes, make sure the knee of the balance leg does not buckle in and the hip does not hike. Instruct the individual to keep the glute of the balance leg contracted and the navel drawn in. The third example exercise is a single leg hip rotation. This exercise primarily challenges one's ability to stabilize themselves in the transverse plane, the plane many individuals injure themselves in. Have the client stand upright and contract the gluteals on the balance and rotate through the hip. As with the previous balance exercises, watch the foot and knee for excessive flattening or buckling. Only rotate as far as can be controlled with no compensations. The fourth example exercise is a single leg lift and chop. Have the individual set up as if they were going to perform a single leg squat. Keep the dumbbell to the outside of the balance leg. Contract the glutes and lift the dumbbell overhead and over the opposite shoulder. Hold and return to the starting position. Again, make sure the foot and knee maintain proper alignment throughout the exercise. This exercise can also be performed holding the dumbbell with both hands or holding a medicine ball. Once an individual can stabilize themselves appropriately on one leg, they can progress to the balance strength exercises. In balance strength training, exercises involve more dynamic eccentric and concentric movement of the balance leg through a full range of motion. The movements require dynamic control in mid-range of motion with isometric stabilization at the end range of motion. The specificity, speed, and neural demand are progressed in this level. The first example exercise in the balance strength series is a single leg squat. With this exercise, it will be very important that the knee tracks in line with the toe. Make sure the individual stands completely upright at the top of the movement and contracts their gluteals. Also make sure the individual is sitting back during the eccentric portion of the movement, like they were sitting in a chair. This ensures proper mechanics between the ankle, knee, and hip, as well as proper control of one's center of gravity. The second example exercise is a single leg squat touchdown. This exercise is identical to the single leg squat, but the challenge is increased by increasing the range of motion and changing one's center of gravity by reaching across their body with the opposite hand to touch their foot. If one cannot touch their foot, they can be regressed by touching the knee or the shin until they develop better control. The third example exercise is a single leg Romanian deadlift. Make sure that the individual maintains a slight flex of the balance leg with the movement coming primarily from the hip, no knee motion. The individual will flex at the hip and reach down towards their balance foot. They may need to start by first touching their knee and then their shin before progressing to touching their balance foot. As the individual becomes upright, make sure they contract their gluteals. The fourth example exercise is a step up to balance. This exercise becomes more dynamic as you're changing your base of support by stepping up onto a step. As one steps up and off the step, make sure the foot stays straight ahead and the knee stays in line with the toes. In the balance position, make sure they contract the gluteals of the balance leg for control. The step height may need to be adjusted based upon one's capabilities. The exercise can be progressed by performing a side or frontal plane step-up and then a turning or transverse plane step-up. The final example exercise in the series is a lunge to balance. This will require that the individual possess high levels of neuromuscular control before performing due to its highly dynamic nature. As with all balance exercises, the foot and knee of both the front and back legs should remain in line with each other. Slowly lower into the lunge to ensure proper eccentric control. In the balance position, make sure the gluteals are contracted for control. Once an individual develops ample amounts of eccentric, isometric, and concentric control, they can then progress to balance power exercises. In balance power training, exercises are designed to develop high levels of eccentric strength, dynamic neuromuscular efficiency, and reactive joint stabilization. These exercises become more dynamic in comparison to the balance strength exercises and will require the individual to perform hopping motions in multiple planes. The first example exercise is a multiplanar hop with stabilization. The individual would first start by hopping forward to challenge dynamic balance in the sagittal plane. The distance of the hop will be determined by one's ability to stabilize themselves. If an individual is having a difficult time stabilizing, shorten the distance of the hop. Make sure as the individual lands that the knee stays in line with the toes and does not buckle inward. Have them hold the landing before repeating. As a progression from the forward or sagittal plane hop, the individual can hop from side to challenge dynamic balance in the frontal plane. From there, they can progress to a turning hop to challenge dynamic balance in the transverse plane. Make sure on all versions the individual contracts the glutes upon landing. The second example exercise is a single leg box hop-up with stabilization. The height of the platform, or box, will be dependent on their physical capabilities. One would start performing the hop-up in the sagittal plane first. They would then progress to hopping up onto the box from the side, or frontal plane. Finally, progress to a turning or transverse plane hop-up. With each version, the individual would hold the landing. Make sure the knee tracks over the toe both before hopping and when landing, and that they contract the gluteals to enhance control of the lower extremities. The third example exercise is a single leg box hop down with stabilization. This exercise is performed similarly as the box hop up, but in reverse. Because they are hopping off a platform, gravitational ground reaction and momentum forces increase and place a higher demand on stability. One would start by hopping off the box in the sagittal plane first. They would then progress to hopping off the box from the side or frontal plane. Finally, progress to a turning or transverse plane hop down. With each version, the individual would hold the landing. As with the box hop up, it is also imperative to maintain proper knee tracking and gluteal contraction upon landing. Implementing a balance program. Implementing a balance training program requires that health and fitness professionals follow the progression of the OPT model. For example, if a client is in the stabilization level of training, Phase 1, select balance stabilization exercises. For a client who's progressed to the strength level of training, Phases 2, 3, or 4, the health and fitness professional should select balance strength exercises. For the client who's progressed to the power level of training, Phase 5, select balance power exercises. You can refer to the table in your textbook for the appropriate acute variables for each phase of training. In summary, balance is key to all functional movement. However, it does not work in isolation and is not static. Balance training should challenge an individual's ability to stabilize outside their normal base of support. Repetitive exposure to varied multisensory conditions can improve balance and neuromuscular efficiency. Training should occur in an unstable environment in which an individual can still safely control movements. A proper balance training program follows the same systematic progression as the OPT model: stabilization, strength, and power levels of training. Exercises in the stabilization level of balance training do not involve much joint motion. They improve joint stability. In the strength level of balance training, the balancing leg moves dynamically through a full range of motion with exercises that require greater specificity, speed, and neural demand. These movements require isometric stabilization at the end range of motion. They improve neuromuscular efficiency of the entire kinetic chain. Exercises in the power level of balance training improve high levels of eccentric strength, dynamic neuromuscular efficiency, and reactive joint stabilization.